Good evening. Hello, everyone. I'm Dr. Salim at Bisa Well Dental Clinic. I'm glad to meet you all again. Today's Dentium Live and follow-up session. With the hot summer behind us and autumn is coming, I hope you're all enjoying this beautiful season. Today's surgery is once again performed by Dr. Chung. I extend my gratitude to him. Today's topic is immediate implantation with minimized bone grafting. I'm confident that through this surgical video, we will have a great opportunity to learn how to handle the bright tissue level system on extraction socket when we have immediate implantation especially. I hope your clinical skills continue to improve every day. We are going to do a brief review before moving on the surgery. Okay, let's take a look at today's case. Today's theme is immediate implantation with minimalized bone grafting, as I said. About the patient information, 33 years old male patient. His chief complaint was, I got the broken tooth while choosing hard food. I want to get an implant, a brand new tooth. His dental history is number 15, tooth fractured one day before. Non-specific medical history and also no medication anymore. Let's take a look at panoramic view of today's patient. Actually, very healthy young patient. However, only number 15 fractured. About the cone beam CT view, we can see clear apical area and also root area and alveolar socket. So this case is good candidate for immediate implantation after extraction. So what about this the photos? Clinical situation is like this. So when we have this kind of fractured tooth of our patient, we have to consider about which option is better for patient and me. First of all, the actually fracture line is very important factor to consider. The slight oblique, the fracture line is better to survive this fractured tooth, as you know. So in this case, actually, the crown lengthening, it means excision the gingiva, and also we preserve the biological width between gingiva and alveolar bone margin. And then we're going to do crown prep and the crown deliveries including the root canal or not. However, the deep fracture line like this situation, the prognosis of crown lengthening and crown treatment is not so good. So we have to decide sometimes extraction and immediate implantation. So that option is better for our patient. So today, Dr. Chung will have extraction of these 15 fractured tooth and the implant insertion immediately on this same socket. About the surgery plan is here, number 15 area, immediate implantation on the 15 fractured tooth area. So the repair, using bright tissue level implant system, and the gap filling using osteogeno graft materials of bovine origin, and the covered with collagen graft too. Today's surgery point is here. According to this diagram, extraction gently, so preserve this the alveolar margin, alveolar crest area, and especially preserve this labial portion of alveolar socket. And then drilling for osteotomy and implantation with a bright tissue level, and gap filling will be achieved. Sometimes we're going to do adding this collagen graft to the ceiling, the top portion of extraction socket. About the bright tissue level, as you know, this brand new implant system is unique and gave us a lot of interesting point and lots of benefit. First of all, the unique point is number one is here. The middle portion of picture is a little bit wider than apex and top portion. That looks like a fatty belly style. So, and also another one unique thing compared to previous version, like supine and implantium, sharp thread, right? So, combination of these two, the characteristic gave us a big benefit. First, we can preserve the crestal cortical area, right? So it means we don't need anymore using the crestal drill, the countersink drill for the osteotomy, for the implantation. This bright tissue level doesn't need anymore this countersink for the crestal area. It means we can preserve perfectly this top portion of alveolar socket. So the crestal area is more stable and more preservable. And middle portion, sharp thread, having a better initial stability, right? So compared to fully tapered implant system, this middle portion, fatty belly style, is better to conserve the top, the crestal, the cortical bone area, and also the better initial stability. Okay, about osteogeno. The allogenograft graft materials came from the bovine origin. So natural bovine grafting materials with osteoconductivity, the highly interconnected porous structures similar to human bone, complete organic substances. So the higher changing to the remodeling and changing to the normal host bone, the neighbor, the bone into the grafting area. So this osteogenograft material is a better option to have a gap filling today. About the collagen graft 2, this collagen matrix is giving us a better soft tissue healing and also promote bone healing potential. So sometimes we're going to use ridge preservation and socket the preservation, the procedure, and this collagen matrix, from porcine tendon type 1 collagen. So easier and faster resorption when you apply this collagen graft to the grafted area. Okay, the comprehensive understanding today's surgery. Before moving to surgery room, I'm gonna introduce about a similar two case. The case 1 is here, immediate implantation with socket preservation. The panoramic view is here. And number 12 area, the lateral incisor have some problem, the endodontic problem. So these tools should be removed and then implantation simultaneously, immediate implantation procedure. So cone-beam CT is here. So labial bone plate is so thin, right? So after extraction, we're going to check the direction, the osteotomy direction for preserving the labial bone plate for a long time, the stability after implant insertion. So can you see the lateral incisor here? It looks like a normal situation, top portion. However, it is not good at the apical portion, so have decided to extract and then immediate implantation. After extraction of these tools, sometimes we can treat with the tetracycline treatment socket area, removing some the remnant of the infected granulation tissues and infected area. And after that, applying the osteon 3 collagen these grafting materials, collagenated grafting materials, is easy to manage, easy to handle, and also these grafting materials helping the newborn formation, socket preservation, and the simultaneously immediate implantation. And after that, bright implant inserted this socket area, the 4.0 diameter and 11 millimeter length. And after that, to connect with the digital abutment for intraoral scanning for temporary PMMA or temporary prosthesis. So this scan abutment is very versatile. Sometimes we're going to use healing abutment as a healing abutment, and also we're going to use a scan abutment. We're going to use sometimes a temporary abutment for the temporary prosthesis, like a dual abutment of a supine system. For this purpose, actually, this scan abutment should be longer than this one. And the implant insertion, like this one, and the bone grafting simultaneously. Can you see the labial bone plate here? So between the labial bone plate and then implant surface, this socket area is filled with graft materials, osteogenic particulated bone. And after that, we're going to use this intraoral scanner and using this CAD program. And finally, we can get the PMMA temporary with the abutment. So, and after that, all the situation is stabilized, including the soft tissue and the emergency profile. And then we're going to do the final impression. At this time point of final impression, the procedure, I prefer to use this BTS procedure. BTS means bite tray scanning, bite tray impression scanning system. So we're gonna make this final lastration, the zirconia crown, the coloring, grazing, and the staining, and depend on the zirconia block. However, nowadays, actually, we're going to use the shade block from the Dentium company. So just to minimize staining, right? So it means a faster and simplified procedure for even though the final laceration, the making procedure. So anyway, finally we got this final prosthesis about above this brighter tissue level implant fixture. Very nice. Shade is good, and the profile is good. Then soft tissues, yeah, the well done healing situation. The panoramic view of post-op. What about this lateral incisor and number 12 area? I think depth, angulation, and emergence profile, all of these considering factors are achieved by using all of these bright TL and the simplified prosthetic procedure. And let's move to another case, similar case 2. Here, we're going to see this number 12 and number 11, the central incisor and lateral incisor upper right of the patient. The actually number 11 area is fractured already, and number 12 also have some the apical lesion and the poor prognosis after root canal treatment, even though the pin the post, but however, it is impossible to maintain anymore. So let's see in intraoral view, the 11 tools, the central incisor already got some fractures. I think a loss of superstructures, posts and crowns already gone away. And number 12, lateral incisor, also very similar situation. So we have to do immediate implantation procedure after extraction. Extraction gently, always we have to do effort preserve the labial bone plate. Labial bone plate is very important key factor to preserve, maintain long-term good prognosis, especially anterior aesthetic area, as you know, right? So number 12 area, lateral incisors, and the number 11 areas, central incisors, extraction, separation tools, and then the removing very gently. And the drill for the osteotomy and bone grafting material first, osteon 3 collagen, and the final implant fixtures are installed, delivered, number the 11 and 12 area, central and lateral incisor area, diameter 3.5 and length 11 millimeter. So can you see this flapless technique? Just extraction gently, and then osteotomy, put the graft materials in, and the implant fixtures in this socket. So no more flap reflection or no more flap design anymore. Just minimize flap reflection, just minimize drilling, and then put the graft material in the socket and implant also. At this time point, diameter 2.5 and 11 millimeter, right? 2.5 diameter is still okay, still strong, even though 2.5. Why? This bright tissue level is stronger than the same diameter of bone level. The actually bone level 2.5 is impossible, almost impossible, because of thin wall layer. So it is impossible to make this the anterior area. However, this bright tissue level, the external connection type, is stronger than any other bone level system. The 2.5 is enough. So diameter, the smaller is better at this situation. Why? Labial bone plate preserving situation is better. The scan comfort cap connection and intraoral scanning. And sometimes we're going to put this collagen graft 2 collagen matrix as the maintaining barrier, the labial plate. Okay, a suture and checking the ISV. This ISV from this tacting devices from Dentium company, the Easy Check. The brand name is Easy Check. So ISV value is 78 and 85. This score is very similar to ISQ of Ostel Mentor, right? So this tapping devices is better and more comfortable to the ISQ. Anyway, higher score over 78 and 85 is enough to actually immediate implantation and immediate prosthesis, immediate loading. However, more conservative approaching done by Dr. Chung at this time point. As you see, number 12 area, you can see the socket root shield technique. So some of remnant of root is still remaining there, the protecting the maintaining labial bone plate. Purpose of maintaining the labial bone plate. Number 11 area, just put the implant with the gap filling of a bone grafting material. And suture, the post-op situation here. And the same as before, intraoral scanner, using this scanner for the temporalization. So using CAD program, we're going to make a PMMA temporary easier way. And the provisional lastration to management of soft tissue molding. And enough time is necessary, especially these anterior aesthetic areas. The aesthetic is another important factor to maintaining this anterior implantation. And another purpose is this aesthetic outcome. So enough time period for maintaining evaluating this the aesthetic areas using this provisional restoration. For me, actually, sometimes 2 months and 3 months, even though the 4 months, enough time is necessary to maintaining and evaluating this aesthetic area. And after that, changing the final restoration using, sometimes we're going to use this custom abutment and the zirconia final restoration. And when we have this final restoration, we're going to use this bite tray impression technique, BTS, just using this putty and the rubber, the light injection type, using this bite tray. So taking it out and then trimming and moving to the model scanner. The model scanner get the imaging data and sending to our CAD program. We're going to make a final restoration, zirconia and final abutment into the CAD program. So finally, this program gave us a final prosthesis using from the zirconia. So I also, as I mentioned before, I want to make a simpler way to final restoration, even though the final restoration. So shading block, using the shading block of the zirconia, and just to minimize the staining is enough to make a final restoration, even though this final restoration zirconia. So the delivered situation into our patient mouse, number 11 and 12, central and lateral incisor. So what about this? So simpler way, however, the outcome is greater. The outcome is better, right? So I satisfied and also the patient satisfied. Okay, the final restorations delivered, and then taking this panoramic view, we're going to see clear this number 11 and 12 area with a better emergency profile and a good marginal bone situation. Okay, let's move to today's surgery room. Dr. Chung Dr. Chung is already prepared to today's surgery. Okay. Yeah. The first step of immediate implantation is a traumatic extraction, right? Sometimes we're going to use this forceps, sometimes we're going to use elevator, and sometimes we're going to use periotome. There are many different devices to extract safely, right? And during this the extraction procedure, the forceps delivery procedure, the tooth was fractured, the crown was fractured, so more complicated situation than before. Can you see the before the brief preview the slide? This number 20, number 15, the second premolar got the two rooted premolar, the labial root and the palatal root. So in this kind of, in this sort of tooth case, actually using this the fissure bar, high-speed fissure bar, then tooth sectioned, and then they separate each other, and the gentle elevating is better to remove the remaining remnant of the root. So I think this is better and simpler way than any other method, right? So the target and key point is here, to preserve labial bone plate without any the harmness. So we have to keep the labial bone plate without any damages. So A gentle extraction procedure is very important first step. So if to rooted the premolar like this, so sectioning by using the high-speed taper Fisher bar is also good the option to removing these tools. But anyway, all the remaining the root tips should be extracted safely, and then checking again, and Dr. Chung is not going to do the flap reflection because he want to have a minimized flap design, minimize damages and minimize trauma to conserve this the crestal bone areas, the crestal, the soft tissue area, and to minimize traumatic procedures achieved by Dr. Chung now. And after extraction, the socket, the curate is using this, the angulation, the curate. Okay, so yeah, checking again. He thoroughly curate this. Oh, I think the little bit the the infected granulation tissues are there. I don't think so actually. Just thorough socket curates from the helping the healthy bone cell to make a new bone formation, the after extraction, after implantation, right? This fresh socket, the really helpful to make a new bone, as you know, right? So the thoroughly curate, and then starting with a Lindemann drill, the holding the proper position, okay, starting the osteotomy. At this time point, as you know, the angulation and depth and the vocolingual positioning is very important to keep the proper positioning in future. Nowadays, actually, these final drills changing the Lindemann style from the conventional style. So this Lindemann style, the final drill is more efficient, removing the cortical bone, the faster osteotomy site was made. And now, can you see the green belt, the green color coding drill? It means 4.0 diameter, right? The same as another implant system of Dentium company, the same color coding. The green means 4.0, blue means 4.5, the yellow 3.5, right? This bright the system have odd number lengths, so 7, 9, 11, 13 millimeter. Another previous system like Superline and Implantium have an even number, 8, 10, 12 millimeter. So 1 millimeter gap between the Sprite and the Superline system. Okay, after osteotomy, now Dr. Chung put the graft materials, osteogen of bovine graft materials, put this graft materials into the socket first. Why? I think this procedure, this performance is better than the gap filling after implant installation. Why? This graft materials make a better initial stability, right? More tight gap filling. We can get the tight gap filling, the first graft material in the socket, and then next implant insertion. It depends on the colleague. Your colleague have a different style. Some guys have implant installation first, and then the gap filling with the graft material, a little bit this kind of particulated bone. So however, Dr. Jones preferred to bone grafting into the socket first and implantation next. This procedure gave us a tight gap filling and intimate the contact to implant surface. So the better initial stability will be achieved. And this plastic handle removed. This one is scan abutment, right? Digital abutment. The official name is digital abutment, multifunctional abutment. First one, the working as we can use as a healing abutment. Number two, a scan abutment for the scanning purposes. And number three, we're going to use this temporary abutment for the temporization with the PMMA, temporary processes. So multifunctional digital abutment was connected with the bright tissue level already installed. And now Dr. Chung is starting the making a suture, a little bit modified horizontal suture style here. There are many different ways to make a suture knot. Some guys prefer to make cross suture, internal cross suture, and some guys just interrupt the suture, and you can try like this horizontal matrix style sutures also. Depend on this suture style, some benefits are different a little bit. However, these small socket areas, interrupted or the internal cross sutures and like this, the horizontal matrix style doesn't matter. Another purpose of sutures, holding the graft materials between the gap, socket, and implant surface. Okay, can you see the tap, tap, tap? 7 tapping for making a correct score. So, I think, proper connection is the digital abutment with implant fixture, right tissue level already. So this particulated bone for the purpose of gap filling is good. And now this collagen matrix applied on the buccal area, the protecting this the particulated bone. And another way so faster finishing today's surgery. This is the advantages and big benefit. The faster the procedure, faster time to consuming the installation of fixture. That is bright tissue level. Okay, thank you for watching, and we will have a 10-minute break, and then coming back to another session. Thank you. Thank you for waiting. Let's take a look at the post-op intraoral view. As I mentioned before, this 3 notched digital abutment connected to right tissue level already installed into the socket area, number 15 area, and the gap filling with osteogenic grafted material, granulated graft material, and covered with collagen graft 2 collagen matrix. So the panoramic view here, I think a depth of implant installation is good, and also angulation was good, and all this emergence profile also good. Let's take a look at the cone-beam CT view. This labial area, can you see this the bone graft materials, osteogenic grafted material? So socket filled with graft materials, socket filling concept, and between labial bone plate here, the minimum 2 millimeter, as you know. So this vocal plate is enough wide. I think long-term prognosis, long-term maintenance is no problem anymore because of this, the maintain the labial bone plate enough. And the CAD temporarization, trying to intraoral scanning. And these PMMA temporizations connect with just scan digital abutment, right? Tap on the digital abutment, the ready-made this, the designed and milled, the PMMA temporary abutment connect with top of this digital abutment, and then the cementation with a temporary cement, or like this resin splinted also available. It depends on this the rigidity and angulation and situation, the bite force, opposite dentition. So I think it is a good option, one of the good option, the resin splinted with a neighbor TS. And for a long time, like a minimum 1 month and 2 months, and then after that, changing with final lacerations of zirconia crown. Before making the final laceration, we have to do impression using this BTS scan, BTS technique. Take an impression with a bite tray and the trimming and the scanning with the model scanner. We can get the final process is like this one. And the milling, coloring, sintering, grazing, all the procedures was done for making the final laceration of zirconia block and connect with the final laceration into the patient mouth like this one. Very nice, well done, the good situation and good soft tissue molding. Okay. Okay. Here is a question, 2 questions we have. Can you see the previous this post-op situation? I think the final lacerations, all the prosthetic procedures was done very nice and the good result was achieved, right? So the bright tissue level, the essential of bright tissue level is that simple and faster and easier way, right? All of these factors gave us a good benefit, the favor. So if some the complicated case or I think all the cases make it easier and make it better, make it simpler using this bright tissue level. That is our today's surgery point, actually, that that is my comment and point. Let's move to question. First, when performing bone graft procedure using particulated bone graft, what is the easier way to achieve? First, this particulated bone, even though the particulated bone itself have some adhesiveness, like osteogenesis material have some adhesiveness. So just the soaking the saline is enough to move to the grafted area. However, if you want more, the PRF, like make a sticky bone, is another option. However, this procedure is so complicated, so it is not recommendable to you. Another way is the mixing with fresh blood, or the changing the paradigm to moving the collagenated bone instead of particulated bone. All of these different ways is a good option to choose. And number 2, is there a good suture method for maintaining collagen graft 2 after bone grafting? Basically, generally speaking, the ALP procedure, the alveolar ridge procedure, preservation procedure, ARP procedure case, actually it is a staged approach. It means a staged approach, just to put the graft materials in socket and couple with collagen graft like collagen matrix. Collagen graft 2 is a good option. And after that, suture, internal cross suture is best option. However, immediate implantation case, like today's case, the actually interrupted suture also available and acceptable. And the horizontal mattress suture is also available and acceptable, right? So I think depend on the purpose and situation. The only ARP, the internal cross suture, right? Cross suture is best option. Immediate implantation, like today's case, you can do the interrupted, the internal cross suture also available, and internal the mattress suture is you can apply it for this purpose, right? Okay, for a long time. Actually, thank you for watching today's video and the surgery viewpoint and the follow-up, the result. Thank you for watching. Thank you again, and see you next time. Actually, next live surgery will be held, will be prepared 25th, the Friday, and October. The same time. Join us next time. Bye.